Go ahead, please.
Good afternoon, everyone. Yeah. Good afternoon, everyone. I'm Samar Bermani, a fresh graduate from Al-Saffar University College of Medicine. And now we're going to have the second session regarding the Module 4 and Day 2 of Capacity Building in Medical Education course. So as we went in the previous session about the aim and target audience, so I'm just going to briefly go through them and the importance of having a Moodle platform and the learning objectives about the module. And now, as we in the previous session, we had the session with Dr. James Gray. Now we're going to have the second session with Dr. Mumtaz Patel. It's a pleasure to have you today with us, Doctor. She is a senior censor and vice president for education and training, and also a consultant nephrologist at Manchester University and NHS Foundation Trust. She's a postgraduate associate dean for health education in England, clinical lead for quality management for the Joint Royal College of Physicians. Regarding the schedule, we're going to have first of all we're going to have a 45 minutes the session, and then we're going to have a 10 minutes discussion about the questions. Just briefly about the ground rules. Please, everyone, mute your devices, and if you have any questions you have put it in the chat box. And when the question session will come, you can raise your hands, and we will present the questions. And that's it for now. It's a pleasure again to have you with us, Dr. Patel, and you can present your lecture.
Fantastic. Thank you, Summer, for the nice introduction. So I'll share my screen and try and load my slides. Give me 1 second, which is here. So can you see that okay, Hilal and Summer?
Yes,
everyone?
yes, it's okay, Mumtaz.
Yes, and if I just move one slide and make sure that's moving for you, that's okay, isn't it?
Okay. Okay.
Fantastic. All righty. So thank you so much for the kind introduction and inviting me to present as part of the Capacity Building in Medical Education course. And today my title is around modalities in clinical assessment. So I'm hoping in the next kind of 45 minutes or so, I'll hope to cover some aspects, and then we'll have some time for question and answer at the end of it as well. And we can talk through any queries that you have at that time as well. So what I'm hoping to cover is basically kind of, you should be able to, by the end of this session, understand the importance of assessment. I'm sure you do, you've gone through it yourself, but also kind of the definitions, the role, the more the how, and gain knowledge in selecting and implementing appropriate assessment methods in medical education, particularly in clinical sort of settings as well, and appreciate the potential benefits and limitations, particularly around workplace-based assessments, and that's more so assessment on the ground for individuals. And also understand the value of feedback, because like any assessment tool is as good as you use it. And the feedback aspect side of things is extremely, extremely important to drive the learning going forward. So I'll cover a little bit of feedback aspects, which I think is really important in the assessment context, and then go through the potential value of workplace-based assessments in evaluating both competence and also struggling sort of students or trainees. And that was kind of an interest of mine. That was kind of the basis of my dissertation when I did my master's in medical education some years ago. And I'll just share some of the key findings of that towards the end of the presentation as well. So I hope that's helpful. So starting from the very basics, and I know, Sama, you were just saying you kind of just ended your journey as a medical student, but the journey is very continuous, isn't it? From undergraduate to postgraduate medical education. And even now, it's very much lifelong learning. I'm, showing my age, 25 years plus as a graduate, but still so much learning for all of us to do. So, from your undergraduate training to becoming sort of a junior doctor, and that ongoing learning development. You have assessment. It doesn't finish, sadly, at the time of graduation. The assessment still continues in different ways. You get lots of feedback along the way, and then that helps you progress to the next stage of training and the next stage of your career as well. So it's a kind of a continuous journey that we're all on, and it continues, I feel, lifelong. I still have lots to learn, and I still learn even from my children now, who tell me about things that they're going through now, which were very different to when I trained as well. So kind of starting from the very basics, I guess, definitions of assessment. So what is assessment in the context of professional practice is what we do. So I guess for us, it's a very much a systematic process in the professional medical world for measuring a student or trainee's progress at the level of achievement against defined criteria, and making a judgment about that student or trainee. And that's from our General Medical Council. That's our regulator here, and I'm sure you have similar regulators in Iraq and elsewhere as well. And the other definition and the importance around it is just checking whether learning has taken place. So you're giving out all this teaching, what is being learned during that process. And also, more importantly, it's about to get to know your trainees, particularly around workplace-based assessment and things. I feel that's a really good one-to-one opportunity where you can get to know your students, your trainees, get to tailor their learning according to their needs as well, and providing that personalized learning, which I think is really important, which then drives, kind of their learning as part of that assessment framework as well. And why is it important to assess? I mean, some would say, get rid of all the exams, they're too difficult and we don't need them. But it's really important to maintain that patient safety and standards of patient care that we deliver. And why we assess is to ensure that we are training correctly. So if we're just training and not assessing, then we don't know whether we're doing the right thing. Are we making an impact? Are people, kind of doing the right things afterwards? Are their outcomes, patient outcomes, improving because of the quality of the training as well? We need it to align to the curricula, which is really important. We need to reassure the public and our patients that we're training and learning in the right way. And it supports the development of students and trainees, and also provides evidence when we're dealing with underperforming students and trainees as well. So that's the why around why assessment is important and why we do it. And then going on to the different approaches. So even when I was training, which is a long time ago, probably before some of you were born in the 90s and early 2000s, it was very much about big essays, knowledge-based kind of assessment. And then over time, you had more professional knowledge, which was looked by long cases, short cases in my final exams, as well as then my MRCP exams. And then the professional skills were being assessed by, in different ways on the wards. And then the technical skills, like the procedural one, it was very much you see one and then you do one and that's it, you're done. There's no kind of competency framework around that. Even the first central line I did, I was looking in my book in the middle of the night and I was just doing it. I would hope people would have to do that now in an unsupervised, unsupported way. And also, medicine is more about professional skills and knowledge. It's around behaviors and attitudes and how we assess those. And when we know that doctors, go into difficulty and things, it's very much less about knowledge and skills and much more about attitudes and behaviors. And how do we assess that? And, do we look at that? And is it very much holistic judgments? That person's a good person, that's okay. So we need frameworks for, how we assess in more sort of detail. So those traditional approaches were fine to a certain extent, but many of them just tested knowledge, not application. Many were very subjective, opinion of a few people. Even when I did my MRCP exams, there was only 2 examiners who I was walking around with, and now it's much more OSCE-like structured and things. And that lacking of standardization, very inconsistent, and the curriculum per se wasn't systematically being examined. So historically, those subjective holistic assessments were very much based on that apprenticeship model with poor measuring qualities. And over the last two decades or so, we've had lots of changes in postgraduate medical education and much more competency-based assessments now, as well as training. And that required newer methods of assessment as well. And this led very much to the introduction of workplace-based assessments and the thought of that we need different forms of assessment to drive learning and to allow that kind of breadth of training to be assessed in a much more holistic way. So the rationale around workplace-based assessments was very much that the competency-based curriculum requires confirmation that competencies have been met. That then demonstrates that adequate progression to completion, and also that societal demand around regulation. So we have lots of now patients complaining about lots of different things, and we need to be, assured, the patients need to be assured that there is that ongoing monitoring of quality of what we're training, but also the quality of care that we're delivering as well. And also it provides that opportunities for learning and feedback and gives that wider quality assurance mechanism for both trainees, but also for trainers as well. So what do you want to get from any assessment sort of modalities as well? So they need to have a clear purpose, they need to be fair, they need to be related and making sure that learning has taken place. And whatever we do, it's kind of driving performance, and it could be more formative, it could be more summative, but again, it has to be multifaceted. There's no one assessment tool that can assess everything, so we need different forms of assessment tools at different levels, at different times, and certainly they need to be reliable in what they're assessing as well. And we use that terminology between summative and a formative assessment. So formative drives training, and then the summative one is much more pass-fail. Those hurdles need to be crossed and, still need to have opportunity to give feedback. And that formative aids learning through that constructive feedback. And feedback is so, so important. Without constructive feedback, that could be destructive and not supportive to the learner as well. And then the summative bit determines that level of competence for progression as well. And then we have appraisals, regular appraisals, opportunities. The ARCPs is more annual review of competence progression that we do here in the UK. You may have similar systems in Iraq as well, which we can talk through when we come to the discussion as well. And that can review more your progress over time as well. And many of you, I'm sure, have covered, the Miller's Pyramid of clinical competence and learning. So that kind of goes from kind of a stepwise way. So the lower bits are assessing more cognition, more knowledge and skills, and the higher orders of thinking is more assessing the behavior side of things. So the lower ones of the assessment tools, for example, the traditional MCQs, the essays, the knows how is much more around interpretation and application. And then the demonstrating of learning, like I'm sure some of you have had in your finals for the OSCEs. And then how do we truly assess the knowledge, skills and behavior integrated into practice? And that's where the workplace-based assessments and more the competency assessments, the capabilities in practice fit in right at the top of the Miller's Pyramid. And that hierarchy of thinking, so all the assessment modalities are looking at different things. And it's that higher order thinking at the top, which is where we want to get to as senior clinicians. So it all starts with just remembering lots and lots of facts, but that's rote learning is not going to develop you in itself. You need to understand and apply that knowledge. You need to be in that position where and analyzing and evaluating and that critical thinking and creating comes into play. And that's where the sophisticated thinking comes into play. And that's what we want to get to as senior clinicians, or even at clinicians at any stage. We want that higher order of learning and thinking in that sense. And that's what the assessment modalities in clinical teaching should be achieving over time. And thinking about the different types of assessments, so lots of different types of assessments. So some for the workplace-based assessments are based purely on clinical encounter, and that could be the mini clinical evaluation exercise, the case-based discussions, and those are kind of detailed here. Some may be based on procedural skills around observing, so I do that for my central lines, for our renal biopsies as a renal physician. And then the ones around professional behavior, which are like the multi-source feedback, the team assessment of behavior. And those are kind of anonymized multi-source, so multiple people being asked about your performance and your competence and your communication skills. And that's very much, kind of a holistic way of looking at performance and your personal development and how you can improve within that as well. And anonymized, collated, and then suitable feedback to drive you forwards as well. And when you're thinking about assessment, what are the features of a good assessment system? So Van Vooten, that I think I've referenced later on, talks about reliability. So they need to be reliable, whatever the assessment methods. It needs to be valid. It needs to be feasible. It needs to be openly transparent and has to make an educational impact. So that's the bit where sometimes it's lacking. You give all these different assessment methods, but does it actually make you a better doctor? Does it make you a better student? Does it change your professional practice? And those things are probably really important on the ground, because otherwise you don't see the point of doing all of these things. And those features building on that. So when we're talking about reliability, so multiple choice questions, if we retest the training at different times with the same questions, does it produce consistent results? So like things like multiple choice does, but things like workplace-based assessment probably doesn't, because you'll have the reliability issues with who's doing the assessments, what cases that you're seeing. So there may be some variability. And validity, does it measure what it's supposed to measure? Does it cover those knowledge, skills, and attitudes that it's designed to cover as well? So thinking that through is really important as well. And then the feasibility around good assessment, is it practical to use? If it's too difficult to implement, then it's really hard and you can't do it day to day. If it's really expensive, again, that may be a cost issue as well. And is it transparent? So a lot of the exams get slated because of, they're not transparent. The standards aren't clear. Lots of people are failing and nobody understands why. So those things need to be very clear and understood both by the assessor, but also by the learner as well. And that educational impact, is it driving learning? Is it changing and improving your practice on the ground as well? So looking through the trajectory of how assessment has happened over the preceding years. So around over 10 years ago, here in the UK, there was the GMCR regulator recommended a series of changes to think about assessment for learning, which is the more formative aspects, or assessments of learning, which is much more summative. And they recommended a number of different things, but supervised learning events, which built on the concept of workplace-based assessments, came into play at that time. And workplace-based assessments were usually formative, can be summative in some cases, particularly like the procedural drops and things. They're trainee or supervisor-led. And again, they stress the importance of effective feedback. It should lead to an action plan, which it doesn't always, and they contribute towards the annual review of progression as well. And some of the different forms are listed here in the box below. And the supervised learning events, which came into play about 2014, about 10 years ago, were much more formative, trainee-led, promoting learning through that self-reflection and feedback, again, should lead to an action plan and contribute to the annual review. And again, some of the examples are shown here. And you could have external assessments as well, like the MRCP exam and other, professional exams as well. And our role as a supervisor is making sure that the trainees are preparing for that. And if there's appropriate courses, I know Iraq has been doing lots of PACES courses and things, and organising formal study days and supporting your learner to attend these things so they can attend these things as well. And this just gives you the suite of the different, how do you assess curriculum content? So you can't assess it just with one tool. You need lots of different things to assess it. So this shows the range of different things. So you could have the procedural skills looked by the DOPS, the procedural skills assessment tools. You could have your case-based discussions for your clinical skills, your teaching skills for teaching assessments. So lots of different things. And then the knowledge-based exams could be testing the knowledge and the broader skills. And then the multi-source feedback, looking broadly as the communication and the professional behaviours. So lots of different things to assess the curriculum content is important. And then there's been lots of debate around the utility of workplace-based assessments and what are the strengths, what are the opportunities. And it'd be good to hear when we do our Q&A whether you use that here in Iraq as well and how that works in your context as well. But when we think about the strengths, I guess they are highly valid because they're assessing, kind of performance on a day-to-day basis in professional practice. They're authentic, they're feasible, you can do them day-to-day, and we feel that they make an educational impact if done well. And I think the opportunities are that it allows that one-to-one trainee interaction, it allows feedback to be given in that kind of way, and hopefully it drives learning as well, and allows the monitoring of progression if done well. But there's that perception from a weakness perspective, it may not be as reliable. So if you come to me, you'll hopefully get good feedback, I'll be supportive, but then other trainers may just see as a tick box exercise of just getting it done and not really learning from it. And it may vary from different observers, different cases. And time is always an issue for training and supervision, isn't it? So me as a trainer, I'd love to spend loads of times with my students and my trainees, but sometimes that constraint doesn't allow adequately to do these things in as optimal way as you could. And then that leads to that lower effectiveness as well of these tools. And the key differences between the newer workplace-based assessments, supervised learning events versus the traditional ones, I guess, is that the newer ones replace the sort of the tick box, just number of quantitative things by much more qualitative feedback. So it asks more about, the context, the description, and, hopefully that qualitative discussion and feedback drives that deeper learning. And rather than just a number exercise to say you need this many assessments in a year, it's much more around the quality of the feedback that you're getting as well. And the benefits of broadly workplace-based assessments is shown here. So for the trainee or the students, it's an opportunity to receive some feedback, identify learning needs, motivation to improve and achieve, and measuring your own progress. And then for the supervisor, it's an opportunity to observe the trainee. I really like doing the assessment tools just because I get to see how people are performing on the ground. I get the students to say, lead a ward round, and then I can observe my trainee doing that, and then I can give feedback of how decision-making was done, and also, identifying any learning gaps as well. And broadly speaking, for patients and the general public, I guess it's making sure that they're reassured that the students and the learners and the trainees are adequately qualified, and that they are being regularly assessed within their training programs to drive their learning and identify any issues as well. And that utility of an assessment method, like I mentioned before, is covered by these, kind of 5 aspects in particular around reliability, validity, educational impact, acceptability, and cost, particularly from a university or a postgraduate institution side of things. All these things need to work for this to be successful. And when you're looking at that utility of the assessment method, what is good where? So for example, multiple choice questions, highly reliable, you can reproduce them, it's a standardized, it's a way of doing it, they're valid, but does it really drive learning? Does it make an educational impact on the ground? Maybe not as much, because it's very much, knowledge-based and application may be limited. But yes, they are acceptable, and I think they have a place. Whereas OSCEs, yes, again, reliable and valid, but the educational impact definitely is better and they are acceptable. And then workplace-based assessment, I think the reliability can be an issue because of intra-observer variability. As I mentioned, they are still valid. They probably make the better educational impact if they've done well. And then acceptability, again, because of the variability of approach, has been questioned. But again, if you do it properly, then I think the acceptability as well as the impact can be high. And for any of these assessment tools, I think it's most important. I think many of our students, as well as trainees, and even us as consultants, many times we do everything right at the end. So if we do everything, cram it in at the end, is that a good way of doing it? But probably not. So I think spreading the assessments through trainees, rotations and things is felt to be better. Doing as many assessments as possible rather than just thinking to the minimum sort of 3 or 4, whatever it is. And then feedback as well as the scores. So the qualitative feedback is as important, if not more important, rather than just the scores. And then following it through. So if you do find some gaps, then do the assessment tool again, and then follow it up with actions, and then hopefully drive that learning as well and embed the learning. And reflection is a key part of all of what we do, whatever the assessment tool. And that ongoing reflection will drive that learning and embed it even more strongly with time. And nowadays in the UK, we have the generic professional capabilities. So this framework was more recent over the last 5 years or so, in 2017, and implemented around COVID time in 2020. So this is relevant to all stages of medical education and training, from undergraduate to postgraduate levels. And what it's trying to say is that the knowledge skills is important, but the professional values and behaviours is central to what we do. And that's the assessment around that is absolutely key. And also saying that beyond just the clinical teaching, all these other facets are equally important. So whether it's leadership, team working, whether it's research, whether it's around education and training, health promotion, illness prevention, these wider facets are so important to drive learning. And a lot of these things are now within our curricula and also in our assessment frameworks. So something to consider when you're developing new curriculum and assessment frameworks as well. And it's these capabilities in practice which look at much more system-wide things. So how does things function on the ground? Is this driving, improving patient safety? Are people able to do research? Can they be a clinical teacher, clinical supervisor? So beyond just the clinical learning is looking at capabilities in a much more holistic sense as well. And then from a specialty specific perspective, this is what our curriculum and assessment frameworks look like. So how good are you of managing an acute take, specialty take, outpatients? And the entrustment level is very much based on the level of independence. So going from direct supervision to being unsupervised, kind of leading things yourself. And that is what we want to get at the end of training programs, that people are feeling comfortable, confident to manage these things in an unsupervised way. And any of these things that we do is kind of a circular thing, like I started with just before. So, you've got your learning, you have your regular appraisals, you have your objective setting, the curriculum is there, your portfolio is capturing all of your learning within it. Within your objectives, you're setting personal development goals and plans. And then you have regular assessment with feedback, which then drives the learning, promotes the insight, and then that learning just continues. And then the ARCP, which we have here in the UK, is that kind of annual review that you continue to have where you're being assessed but looked at, and then that kind of identifies any gaps, and then more learning, and you go down in that way. So that supporting the learner journey just needs to continue in that kind of continuous way. And my role as a trainer is to ensure that that circular sort of learning is continuing with the assessment and relevant feedback as well. And that takes me to the point that without effective feedback, that is the key to success of any assessment tool. So if you just have a standard assessment method and then no feedback at the end of it, then there's no learning. What do you know where you missed out, where you could have done better? So effective feedback is absolutely crucial to driving the utility and the success of the assessment tool itself. And it goes back to that kind of assessment, feedback, insight, learning, as I've just mentioned. And any kind of aim of feedback is to promote insight. It's not to judge. It's not to say, yeah, you're fantastic, wonderful, but, that's good. But also equally, it's not to judge, to just say, sort of offer quick solutions. It's to drive that reflection and learning and promoting that insight. So without you knowing what you need to improve, how can you truly improve? So without assessment, without feedback, assessment has no purpose. So I think it's making sure that those two things go hand in hand and are done well. And then the do's and don'ts of feedback. Again, I'm sure you've had experience yourself of when it's done very well and when it's not done very well. But the doing it very well is very much close to the observation, describing specific behavior, not being personalizing it to judging the person in that say, and making it very specific and very forward, sort of approaches as well. No point criticizing someone and then not giving them any support to say, where are the areas of improvement? How are you going to follow up on the actions as well? So it's really important to do this bit well, to get the assessment bit right, to then feedback, to then drive the learning as well. And the purpose, as we all know, is identifying what people have done effectively and offering different approaches to how it could be done better to make it more effective, identify the ongoing learning needs, and both supporting the individual. Support is truly important, but also challenging when needed as well, because I think challenge aspect is important too, to drive the learning at times, and that can be difficult, but I think equally important to get that balance right as well. And again, like anything, it's the what do we say, how do we say, and does it make a difference? Is it moving the conversation forwards? I'm sure you all know about the Pendleton's kind of feedback things, that sandwich kind of approach. And I know when I'm doing this, I'm just waiting for what people are saying to say I could be improved. So I kind of ignore all the good bits. And then I'm just focusing on what bits could be improved or what somebody's going to tell me. But the whole approach is to describe that gap. Where is the current position? Where do they need to be? Where's the gap? And how that gap could be minimized or eliminated. And then that's your role as a supervisor to agree a plan of how you get there in the end. And the principles around, all the different aspects that I've mentioned around concentrating what can be changed, strategies for performance improvement are truly, truly important, and making sure those aspects are got right at the end of it as well. And, you know, you've done the Pendleton bit, so I'm not going to re-emphasize that point. But again, if there is criticism of approach, making sure that that is measured, and also you're helping people. So rather than just saying you've done really badly on this and that's it, what you need to do is making it very constructive and deconstructing it in a way of how improvements can be made and how things can be driven forwards and improved with time as well. Different models. So, you know, I talked about the Pendleton model, which I think everybody knows of. You've got the Boost model, which I quite like, which is much more balanced. So you talk broadly speaking around strengths and weaknesses. There is also a lot of reflection from the individual learner as well. It's much more conversation based. So rather than just what's good, what's bad, what needs to be changed, it's much more, you know, let's have a broader discussion of how that went. And very much observed, evidence-based, again, objective behavior, not personality, being very specific, giving examples of where that was demonstrated, thinking about future actions of change, and the timeliness. So sometimes it may be appropriate to do it straight away, but other time, given the nature of the situation, they may need some time to just think that through, and then you need to meet again to then reinforce some of the points as well. But as long as it's regular and followed through, that's the most important aspect as well. And when you're receiving feedback, it's so important to make sure that the right atmosphere is created, that, you know, you're involving the trainee, they're figuring it out. Many times the students and the trainees know what they're missing, what they need to do, how they need to improve their next assessment, but it's making sure that they're supported within that journey as well. And the designing and the co-creating the learning plans to then make them more successful for the next assessment is really important as well. And again, that authenticity is really important for active listening as well, being aware of feelings. I know when I first failed my exam, which was my MRCP exams postgraduate, you know, you're very fragile. And I think people need to be listening to your concerns and then helping you, support you to kind of drive your learning in that way, and clarifying, summarizing different points, because you don't take all of these things in straight away. So sometimes you need to do that in a stepwise way, just to hopefully then support the learner to be more successful in the next set of assessments as well. And when you're thinking about this, you know, I guess it's thinking about, you know, kind of what people have done well. That's the conscious competence. That's what we know where we're deficient on. But then when you think about the unconscious competence, you can think about, well, I think you did really well in this area, and people may not always see it, but then that helps drive the learning towards better assessment for next time. What could you improve? That addresses the conscious incompetence. And then when you're saying from your side, that's the unconscious incompetence, I think you can improve in this area. So there's different approaches to when you're talking about these things as well. And getting student and trainee ownership is really important, and feedback in small digestible areas and things, and making it more of a driving the process in a much more positive way as well, and allow that information and dialogue. So you have your assessment, you have your feedback points, you have timeframes where people can kind of take it in, and then you have those discussions to drive that conversation and learning forwards as well. And around deadlines and making sure that that's converted into an action plan. So whenever I've done assessment tools, one of the things that's always a deficiency is an action plan. So you've had the assessment, a workplace-based assessment, you've given some feedback, but what is the action plan? How can you take that forwards? And I think, you know, that could be done by the student or the learner themselves, but then that can be supported by the trainee or the trainer as well. So includes how these things will be met, you know, regular review of these things, and planning to making sure that those things are discussed regularly as well. And any objectives should be SMART, as we call it, specific, measurable, achievable, making sure they're relevant with time-bound, immediate timelines as well, to make sure they are done in that way. So, for example, if you're saying after an assessment tool where you found that the communication skills could be improved, you can say by the time of your next appraisal or your next assessment, we need to make sure that these things are done in this way. And those skills of your learning will be observed with say, a mini clinical evaluation exercise. So you've made it so that you're assessing something, you're giving some feedback at the same time, and then you're measuring the improvement of that with the use of a workplace-based assessment. So really important to capture that. And we talked about the Bloom taxonomy just before. So this is just reiterating the point that kind of, when you're then providing the personalized development plans and the action plans, you can talk about whether they need to think about their knowledge or their comprehension or their application. And these are the things that can be used in the action plan as well, when you're thinking things through. So for example, for me, for central line, development and insertions for my specialty, then the different steps could be that you need to revise the anatomy, you need to observe somebody doing it, you need to perform it with, kind of supervision. But then to be able to be confident around the process, you could demonstrate that by presenting, kind of the nature of what you need to be doing, get feedback after your presentation, practice these things, get some feedback, and then how you would develop an approach, by kind of performing and reiterating your performance as well, with getting quality feedback from other colleagues as well. So, it's a stepwise development plan with using different workplace-based assessment and other assessment tools to demonstrate progression, performance, and competence as well. So I think that concept of feeding forwards is really important. So it's not just feedback on, say, an assessment tool, is how you then improve your performance. You're feeding forwards towards improving and development, and then that translates into that action plan for that student and trainee. So again, thinking about competence versus performance. So these are my latter bits around competency-based assessments. So what doctors can do in a controlled representation of professional practice. And then the performance-based assessment is what you can do in your professional practice as well. So one's more simulated and one's more actual day-to-day stuff as well. But my latter few slides, just before I close, is talking about, whether there's a utility of workplace-based assessments and assessment in looking at broader professionalism, but also does it help identify trainees who are in difficulty? So we all know being a good doctor is much more than just the technical and clinical skills around competence. And many doctors can face all sorts of difficulties from different sources around their performance. And there's lots of evidence to say that the traditional and summative assessments of competence don't predict performance. So just pure exams and pure MCQs don't predict longer term performance. It's more the behavioral and the professional issues which we need to assess. And that arises that question. So how good are the current assessment tools, particularly the workplace-based assessments, in predicting trainees who may need extra support? And that comes back to the Miller's triangle of learning. So we know the supervised learning events, the different newer workplace-based assessments sit at the top of the Miller's pyramid. And they were brought into play to identify training issues earlier. But do they truly have a value in predicting doctors in difficulty? So when I did one of my studies some years ago, we did a retrospective case control study to look at this exact question. So I had many trainees who had a perfect portfolio, lots of demonstrated learning, but then they were getting into difficulty for different reasons. So we looked at the free text comments around the workplace-based assessments. And then we looked at whether those were predicting in a regression model or predictive value. And the only thing that we found was of predictive value in predicting whether trainees got into difficulty was the team assessment behavior, the multi-source feedback. So getting feedback from lots of different people was helpful, and the supervisor report was predictive of trainees who got into difficulty. And then we did a qualitative study as well in the same way. And those factors were important when you were asking the question, are workplace-based assessments predictive of trainees in difficulty? The factors were the types of workplace-based assessments. So multi-source feedback was helpful. Team assessment of behavior was important. The content and the quality. So if they were lacking, each assessment tool is as good as how you use it. If you use it in detail, give constructive feedback, then that helps discriminate the good versus the not so good student or the trainee. So I think how we use it is important, how we assess, and also the bias of the trainees could be in part contributing to whether this is truly a valid tool or not. And when we ask this question around the usefulness, around prediction, around competence performance, the clinical competence workplace-based assessment scored very well. The performance was also relatively good, and the professionalism, particularly for the multi-source feedback, but the prediction around trainees in difficulty was much less, as you would expect as well. So the recommendations around this research was very much that we need to think about assessment broadly, particularly in the modalities of clinical assessments, which is what we're talking about here, and the team assessment of behaviour and the multi-source feedback with structured feedback and earlier and targeted ways of doing that is probably one of the best tools for driving better professional behaviour and performance as well, and also improving the quality of our supervisor reports, which is triangulated information from all the workplace-based assessments. And of course, improving how we train our trainers as well, which I know you're investing a lot of time in here in Iraq as well, with all these lovely courses that you're holding and hosting. And I'm sure that will then drive the quality of the workplace-based assessments, the supervisor reports, and the feedback and the learning and the quality of what you're producing from the trainees as well at the end of it. So I'm going to pause there. It's 43 minutes and I think I'm nearly finished. I can't yet. So the learning objectives I had at the start of my session were around the importance of assessment. So we talked about the why, the need, the different types of assessment tools, and the importance around driving standards, both for training but also for patient care. We talked a little bit around the different assessment methods in medical education, both from the traditional, the newer assessment tools, the competency-based, workplace-based assessments, and then the newer capabilities in practice. We talked about the potential benefits and limitations around workplace-based assessments and the real importance and value of feedback in clinical assessment tools. And then lastly, we just talked a little bit and touched on the value of workplace-based assessments in evaluating performance and struggling trainees. So I hope that was helpful. Sorry, a bit of a whistle-top tour. You could do this much better in a workshop and a face-to-face environment, but I hope that's been helpful. And I think I'm just about on time with my 45 minutes. I hope that's okay. Thank you, Summer.
Thank you so much, Doctor. That was really amazing presentation. Now we will come to the Q&A questions. So if anyone has any question, please raise your hand or write it in the chat box. So we have one question from Dr. Jamal Saleh.
Yes.
He says, thanks for your presentation. My question might be a bit away from what you have discussed. If I designed an assessment in which the medical students' pass rate is 98% in the first trial, does it matter? I know theoretically it could happen in ideal world, but in real world and in a developing country, can standard setting be a solution in this case? Thanks.
Thank you. So thank you, Jamal, for the good question. I guess, you don't have to have assessment tools who are failing lots of people for it to be driving learning. So if you set an assessment and, the pass rate is very good, what you want to see is that truly representative of the learning? Is it that, every teacher is so good and, everybody is kind of coming up with all the answers? And I guess time would tell. So what you need to do when you do the standard setting and the blueprint for any assessment tool is seeing, the validity around the assessment tool as well. So if that happens for the first time, that's great. But, if you're finding then that every time everybody is just, getting, near 100%, is that, truly representative of the group? Are you missing something? Is it mapped to the curriculum as well? So theoretically, yes, it could happen, and that's okay. But what I would do is just review both the standard setting and kind of the pass rate side of things. The assessment tool itself might be okay, but what you're asking and whether it needs tweaking. On the other hand, in the MRCP setting, in the postgraduate side, we have it the other way round. You know, our pass rate traditionally has been much lower, 30, 40% in certain centres. You could argue, is that wrong? Is the bar too high? So I think that's where the standard setting comes in. You need kind of regular, kind of evaluation of your assessment tools to then assess whether kind of the quality of the tool is right, what the standard or the setting that you've done is correct, and whether there needs to be any calibration around it. I hope that helps.
Yeah, thank you so much. It was very clear. Now we have Dr. Al-Saffar, please present.
Thank you, dear Mumtaz. As usual, brilliant, excellent, very informative and very useful. I have two short questions. The first one, what are the modalities you are currently using at Sheffield Medical School in assessing the clinical skills apart from OSCEs? And the second one, we hear about, or frequently in the literatures, about the entrustable professional activities. Where do you fit that terminology in your presentation, or is it similar for the work-based assessment or not? Thank you.
Yeah, no, absolutely. So currently, I mean, I think in undergraduate world, postgraduate world is much more standardized, as you know. But in medical schools, there's that variation of different kind of standards. So in sort of Manchester, we have like progress tests, which is multiple choice questions, which happens twice a year, every year from year 1 to year 5. So that's multiple choice questions. We have ongoing assessment tools, which is kind of like workplace-based assessments with feedback, which happens within the placements, particularly year 3, 4, 5.
And this is summative, Mumtaz? That is summative?
So that's formative. So summative is the progress test that they have. That's the multiple choice questions. The other summative bit is the end of year exams that they have, which is a combination of, kind of multiple choice questions, short answer questions, and also they have the OSCEs at year 3. So once they start clinical training, they would have OSCEs in year 3, 4, and 5. And then the formative bit is the assessment tool. So you have like the multi-source feedback in the clinical years. That's where the interprofessional learning comes in, because that's where you get feedback from your nurses, your physios, your healthcare professionals and things. And that would then formulate the supervisor report that I would write at the end of their placement. So you've got summative, formative, and the interprofessional bit is more the formative aspect.
And about the entrustable professional activities?
So I think there's lots, yeah. So the interprofessional activities and the learning happens, particularly in the clinical years. There's more formative assessment within that as a group, and group teaching, and then group assessment and learning, not summative, more the formative learning.
Thank you.
Thank you so much, Doctor. And next we have Dr. Nazar Haddad. Please present yourself.
Thank you very much, Professor Mumtaz, for your wonderful presentations. I would like to ask about the way of feedbacks and clinical assessment. For example, on OSCEs, is it on individual levels or at the group levels or cohort levels? What is the way that you have good practice in your areas? Thank you.
Yeah, no, that's great. Thank you for the question. So in the 3rd year for medical students, when we do the first time they have a formal OSCE, we do it as a formative OSCE. So when I do that, they literally have the stations for the 8 minutes, and then we do feedback 1-to-1 at the OSCE station. So that's a complete, first time they ever do an OSCE, they will have a formative OSCE in which they get feedback 1-to-1, each student with the 2 examiners at the end of each of the stations, 8 stations, and they will build in extra time. So that OSCE will run very differently, and that's completely formative. It's not marked as such. They will just get a mark at the end of it, but it won't count towards the end of the year. But then the rest of the OSCEs, once they understand, and this is in Manchester, once they've done that bit, then they have the end of year more summative OSCE. And within that, the feedback they'll get is from the 4. So we have, kind of iPads for each station. We write the feedback and things within that. And then they will get the cumulative feedback, back to the students on request. Otherwise, it's cohort feedback that they get. So that's the kind of the standard process. So we would do the first ever OSCE with very much one-to-one, face-to-face feedback, each station, very personalized, takes longer, 1.5 times the normal OSCE time, but it's meant to, we always get really positive feedback from the students to say that it's a really good way of learning for them. It gets them used to what to expect and what we're looking for as examiners as well. And then the subsequent ones are done at request, personalized, but more so as a cohort.
Thank you very much.
So I think we don't have any more questions. We have 10 minutes.
Bless you.
Okay, so we have one more question from Dr. Diyar Jafar. Yeah, he says, is there any way that students can help in improving the process of assessment? If so, what's your advice for us as medical students?
Oh, so I think, yes, most definitely your voice is really important, because I used to think as a medical student, everything's very unfair and why are people just assessing all these things for us? So your voice is equally important. So I would always say that, you know, I'm sure you have like your medical students kind of societies, your voice within your groups. You can feed back to say, actually, you know, and this is how we've also driven standards as well. There've been times when we've set exams and they've just been like really hard, or the different tools are not working. And the students have been really helpful to try and help shape us. So on our assessment committees, we have student representation. And I would advise for all medical schools, if you don't already have that, you should have that, because you're a very important voice. You're the one who are doing it on the ground. So it should be that you should have that voice. And if you have strong feelings of, actually, we need to have more formative things, the end of year, just exams really doesn't work, because we used to have just essays and essays of very, you know, rote learning stuff. And over time, that has changed. I mean, that's been a general drive, but I'm sure the student voice helped, because, you know, it wasn't a way that we were learning. We were just reproducing facts and things. So I would definitely say, you know, kind of, if medical schools don't already have students within the committees, the seniors here should be considering and making sure that you do have a voice within those committees. And then you could kind of make, you know, put forwards newer methods of assessment within your sort of areas of medical school, but also in the postgraduate setting as well. Thank you.
Thank you so much, Doctor. That was good. I think we don't have any more questions for today. So, yeah. Thank you so much for students. And I think that's the end of today's session. Thank you so much, Doctor, and thank you everyone for attending this session.
Thank you very much, dear Mumtaz. We appreciate your support and encouragement and participation to the RCP Iraq network. Thank you very much, and looking forward to seeing you soon, inshallah.
Yes, very much so. And thank you so much for having me, and always a pleasure to be with you. Always makes me smile when I see everyone's faces. So thank you so much for having me. And inshallah, see you again very soon. Take care and have a lovely weekend, and Jummah.
Thank you.
Assalamu alaikum.
Salam.